Good evening, everyone. My name is Camille Kidd. I use she, her pronouns, and I'm with In Our Own Voice, National Black Women's Reproductive Justice Agenda, the sister organization of In Our Own Voice Action Fund. Thank you for joining us tonight for a discussion about the threat Project 2025 poses to reproductive justice for Black women in the United States. We've heard a lot of discussions about Project 2025, but tonight we will talk about the exact policies in Project 2025 and the direct impact they would have on Black women, girls, and gender-expansive people. We'll explore what it would mean to send to reproductive justice policy to build a future where our communities thrive. And we'll also have some time at the end for questions. Please use the Q&A function, and we'll get to them at the end. And with that, I want to introduce you to our panel for tonight. Next slide. They're both formidable reproductive justice advocates, and I want to give them both the opportunity to introduce themselves. So we will start with Bridgette.
Thank you, Camille. Hello, everyone. Thank you all for joining. My name is Bridgette Jackson, she, her pronouns. I am the Director of Policy here at In Our Own Voice, National Black Women's Reproductive Justice Agenda, the only national Black reproductive justice agenda centered in policy, directly centered in policy. With that, I will pass it over to Edwith.
Everyone, thank you so much, Bridgette and Camille. My name is Edwith Theogene, and I use she, her pronouns. I am the director at Center for American Progress, working on racial equity and justice. Center for American Progress is a policy think tank here based in Washington, D.C.
Next slide. Bridgette, to kick us off, can you ground us in this conversation with an overview of what reproductive justice is? You're muted, Bridgette.
Let's try again. Reproductive justice is rooted in a holistic human rights framework centered on holistic well-being. That we can have true autonomy over our lives. So this human rights framework encompasses more than just the right to abortion. It's the right to have children, it's to not have children, and to parent in safe and sustainable communities with the resources needed to thrive. Policies that affect reproductive health, including abortion access, are inextricably linked to broader issues such as economic justice, healthcare access, racial equity, and workplace fairness, all of which you'll hear more about later on this evening.
Thank you. And now, Edwith, now that we have an understanding of what reproductive justice, or what you may hear us refer to as RJ, is, can you give us a broad overview of what Project 2025 is?
Sure, thank you so much. So I'm sure a lot of people have been hearing about Project 2025. Project 2025 is a 900-page plan created by the Heritage Foundation. The Heritage Foundation is a policy think tank here in DC that works on a lot of conservative, right-wing sort of policies. So this 900-page plan is basically a plan that aims to radically take over the American government and change how the government works and operates. This plan wants to basically take away power from regular people and give more control to politicians, judges, and big companies. If this plan happens and becomes the law of the land, it could hurt all Americans, but it might be especially hard on young people, poor people, and groups that already face many challenges in society, groups that we are a part of and groups that we work to defend and protect. So the plan wants to fire thousands of government workers who know their jobs well. The plan also wants to change the way that the government provides services, who are allowed to receive services. It wants to break all the different kinds of accountability that occurs and basically centralize a lot of the power within the presidency. So that is a huge threat because we have to also prepare for who the president might be. By weakening the checks and balances in government, this plan could change so many things. For example, it might let employers stop paying extra for overtime work, control people's choices about having families, and allow insurance companies to treat people unfairly based on their health and history. I know we're going to dive deeper into Project 2025 and talk about some of the different areas, but I just wanted to present a couple of few highlights to show you what Project 2025 could look like. So this year in July, we just celebrated the 60th anniversary of the Civil Rights Act, which is a hard-won protections that many people fought for in the civil rights movement. And Project 2025 seeks to undo and unravel a lot of civil rights protections. Basically, they want to get rid of affirmative action. We already know that this past year, the Supreme Court decided to basically take away a lot of the strength of affirmative action. It did not fully do away with affirmative action, but it made the case to argue for affirmative action even stronger. So with this Project 2025 plan, they will completely try to get rid of that. They also want to get rid of the Equal Employment Opportunity Commission, the Department of Defense, Education and Housing and Urban Development, and the Securities and Exchange Commission. So that also is something that's really critical. Also, under this administration, the Biden-Harris administration, we've had a couple of executive orders that have sort of focused the government to operate with more of an equity lens and consideration. And basically, Project 2025 would undo all of those equity executive orders that were passed under the administration and change the way government operates. It would also outlaw essentially any employee that works on diversity and equity by creating a team of to investigate like the work that they have done within the administration to advance equity. So those are just a couple of highlights, but essentially the main point that I want people to walk away with is that Project 2025 is a 900-page plan that wants to change the way government operates. And that is something that's really concerning.
Thank you for that overview, Edwith. Next slide, please. So we're now going to take some time to walk through what Project 2025 will mean for some of the issues we all care about. It goes without saying that if Project 2025 is implemented, Black women, girls, and gender-expansive people will be some of the folks who will feel the strongest impact. In many ways, it's the antithesis of the reproductive justice policy agenda. The reproductive justice policy agenda was created by dozens of reproductive justice advocates, and it offers expansive and intersectional solutions to nearly 24 policy issues, including abortion access, maternal health, and paid leave. But as Edwith explained, Project 2025 aims to further strip us of our fundamental rights. And with that broad overview, I want to kick off our discussion about how Project 2025 would impact our communities. Next slide. And so we're going to start with Bridgette. How does Project 2025 seek to influence reproductive justice in the United States as it relates to abortion access?
Sure. Well, I want to make this very clear that the policies proposed in Project 2025 are extremely harmful and exceptionally so for Black women and gender-expansive individuals across various sectors and communities. The surveillance and criminalization of our healthcare choices is what is being proposed within this Project 2025. And the exacerbated effects from already overturning Roe v. Wade and the resulting abortion bans in dozens of states, which it must be said, includes 5 states with the highest Black populations, will have detrimental effects, exacerbate the effects that are already happening in this country. So Project 2025 seeks to eliminate not just abortion care, but also eliminate access to contraception, fertility treatments by reshaping policies and legal frameworks. And the use of these tools like the Comstock Act to ban abortion medication and the push for a national abortion database could worsen health outcomes, particularly maternal health for Black women. And a key theme that you will see throughout Project 2025 is hostility to abortion and reproductive rights. So this includes the elimination of references to abortion, reproductive health, and sexual reproductive rights from all federal rules, regulations, contracts, and grants in order to institute what Project 2025 calls a life agenda. And this also includes eliminating the HHS Task Force on Reproductive Healthcare Access and installing a pro-life task force to ensure the department is promoting an anti-abortion agenda. So banning abortion is not pro-life, as we saw with the deaths of Candy Miller and Amber Nicole Thurman. These are two Black women who died because of Georgia's 6-week abortion ban. And the deaths of these two mothers occurred 2 years ago. And it's very likely that others have or will die because of these harmful bans. And it also highlights how challenging it makes seeking care is in life-threatening emergencies in states with these abortion bans. So Project 2025 also, speaking of emergencies, would seek to deny emergency abortion care to people experiencing dangerous pregnancy complications, and to investigate and criminalize the doctors who want to provide stabilizing, life-saving care as well. So within the documents, they have proposed policies for CMS to reverse 4 decades of EMTALA protections, which of course protect people who need emergency abortion care, and would instead use EMTALA to investigate the doctors who provide the emergency care. Project 2025 would seek to increase federal surveillance of pregnant people nationwide by mandating state reporting on state abortion data, which currently is provided on a voluntary basis, but would now be enforced by cutting federal funding for states that don't comply. So the data states would be required to report just how many abortions take place within the state's borders, the gestation at the time of each abortion, the reason for each abortion, the pregnant person's state of residence, and the method used for each abortion. And so it's clear, let's be clear that the reason a person seeks an abortion is no one's business. It's deeply personal. It's a deeply personal decision that should be left up to the individual and their doctor. And the purpose of these requirements would be to create a chilling effect, making patients afraid to seek care in states where abortion is legal, and to cause confusion for doctors as to who they can treat, and instill fear of retaliation and prosecution as well. We are seeing the criminalization of pregnant people, specifically Black people, and all of the terrible things that can come from this. And we can look to the example of Brittany Watts, a Black woman from Ohio who was prosecuted for having a miscarriage at home after being turned away from the hospital. So these anti-abortion activists are succeeding in their efforts to systemically dismantle the abortion care system in this country and erect barriers that make service inaccessible, particularly for Black people who lack economic means and high quality insurance. And this is only further exacerbated through the policies that are suggested throughout Project 2025. They would also deny federal funding as a means to punish states that seek to expand abortion access. It seeks to ban medical abortion nationwide. And once again, like I said, criminalize doctors who provide medication abortion as well as in-person abortion care. Black women, girls, and gender expansive people are more likely to live in these states with these abortion bans. And the same states that make it harder to access, these are the same states that make it harder to access contraception, and also have the fewest resources to help Black families care for their children. One last thing is that, Black pregnant people living in poverty and battling systemic racism are not able to simply just travel to another state to receive this care. So the unfortunate truth and from the Dobbs decision is that the continuing ramifications will continue to be most impactful and, quite frankly, deadly for Black people. It compounds inequities we already face in sexual and reproductive healthcare services, including the highest rates of maternal and infant mortality and morbidity. And so just to sum it all up, many of the proposed policies from Project 2025 would create dire consequences for those seeking abortion care and other reproductive health care services. So the negative consequences of these policies would be felt most harshly by Black women, girls, and gender expansive people.
Bridgette, thank you for linking how Project 2025 will further place restrictions on our bodily autonomy and how attacks on our reproductive health care impact our community's ability to receive the care that they need. Next slide. Edwith, we know the reproductive justice framework is broad and includes economic justice. How does Project 2025 seek to influence reproductive justice in the US as it relates to the economy?
Yes, thank you. It impacts the economy in a lot of different ways. So Project 2025 proposes a series of different policies that are going to be very harmful to the middle class and to those who are vulnerable within this economy. So one of the first policies that Project 2025 proposes is higher taxes for the middle class and lower taxes for the ultra wealthy. In the short term, that means establishing a two-tier tax bracket, which is an increase for low and moderate income people while cutting taxes for the wealthiest Americans. Under the plan, the typical family would pay about $3,000 more a year, while the 45,000 wealthiest families in the country would get an average annual tax cut of $1.5 million. In the long term, replacing income and corporate taxes with a consumption tax, which would trigger a massive boost in inflation and reduce the amount of after-tax income for all but the top 10% of earners. The bottom 80% of earners would pay between 6 and 28% more. So that is one of the ways that it does impact one of the policies, which is very detrimental. Another policy proposal that is included in Project 2025 is the plan's authors have called for raising the full retirement age for Social Security from 67 to 69 for future retirees. This essentially undermines retirement security. It would cut Social Security benefits for 74% of Americans, or nearly 245 million people. It also includes massive cuts in benefits. The typical future retiree would lose between $46,000 to $100,000 in benefits over a decade, depending on when they claim Social Security. Also, it acutely harms women. Women live longer and have to draw down retirement benefits over a long period. Lower lifetime earnings equals lower retirement wealth. So equals more reliant on Social Security benefits. So if you lessen the benefits, this is going to be a unique challenge and difficulty for women. Another policy that is under the Project 2025 policy proposals is they would like to also pull the rug out from caregivers. In doing so, they want to cut access to long-term care for aging parents, low-income kids, and people with disabilities. Roughly 30 million kids and nearly 20 million seniors and non-elderly people with disabilities rely on Medicaid for their healthcare needs, and particularly coverage for long-term care. Project 2025 caps Medicaid payments to states and gives states the power to deny coverage of certain types of care. Included in that, they also want to eliminate the Head Start program. A lot of people really depend on Head Start. Head Start provides no-cost early education for 833,000 families living in poverty. They also want to take away free school lunches. They want to end the community eligibility provision, which allows all students who attend schools serving a student body wherein at least 25% of students are eligible for free or reduced price school meals to receive free school meals. That's nearly 20 million students. So they will no longer have that benefit. So those are just some of the policy proposals that Project 2025 proposes for the economy. And the implications of that are very dire. It would put a lot of strain on working class families, on lower to moderate income families, and put so much more money within corporate hands and allowing them to have free reign on our economy.
Thank you, Edwith, for outlining all of the ways Project 2025 attacks our community's ability to take care of their families and communities. We know the economy is top of mind for a lot of us, and it's shameful that Project 2025 aims to further limit people's access to critical social support programs. To continue talking about our economy and what Project 2025 would mean to Black women and their families, Bridgette, how does Project 2025 seek to influence reproductive justice in the US as it relates to the workforce? Next slide.
Certainly. So one of the goals of Project 2025 is to take a lot of the power from working people and place it in the hands of big corporations and ideological extremists. It proposes rolling back decades of labor laws and rights and replacing them with policies based on, frankly, racist and sexist beliefs about making corporate profit over worker well-being. Project 2025 seeks to eliminate the EEOC requirement for larger employers to report data about their employers' ethnicity, race, and gender by job category, which is an important tool to ensure that certain employers are not discriminating against people of color, women, Black people, when we discuss hiring and promotions. Project 2025 seeks to enable employers to refuse to make reasonable accommodations for employees who have known limitations due to pregnancy, childbirth, or related medical conditions, including abortion, which is required under the Pregnant Workers Fairness Act. Project 2025 would also allow for discrimination against transgender workers by rescinding regulations and guidance that prohibits discrimination based on sexual orientation, gender identity, transgender status, and sexual characteristics, including in hiring and firing as well. It also seeks to weaken overtime pay protections and would allow employers to avoid paying overtime for an employee who worked over 40 hours a week, as long as the employee's hours were cut later in the month to make up for it. Project 2025 would also undermine the ability for workers to form and maintain unions, and would make it easier for employers to retaliate against workers who are organizing, and also to decertify these unions. So while the harms of Project 2025 are extensive, the broad range of workers most damaged will be Black women, women of color, just women broadly, who predominantly are in low-paying jobs, are independent contractors, and those that require reasonable accommodations. These include people cleaning homes and buildings, caring for children and elderly individuals, people that deliver groceries, and provide other essential services that are protecting the public and also keep the economy afloat. So overall, Project 2025 would be terrible for worker protections and make discrimination easier for employers. And as we can all imagine, it will be women, Black people, immigrants, LGBTQIA+ people, and other people of color most impacted by these policies.
Thank you both for walking us through what's at stake if policies from Project 2025 are implemented. Now that we know what Project 2025 would do to Black women, girls, and gender expansive people, let's shift our discussion to talk a little bit about what is possible. For every destructive policy Project 2025 outlines, we know there are reproductive justice policies that would actually support our communities. And so with that, Bridgette, can you talk a little bit about what effective policy solutions can be implemented to counteract Project 2025 and ensure the protection of abortion access?
Certainly. Let me first reiterate that access to abortion care cannot be separated from other human and reproductive rights. Every person, like I said earlier, has the right to make the fundamental decisions and have unrestricted access to abortion services. And this must be part of basic primary health care. We must trust Black women, girls, and gender expansive individuals to make personal decisions that is best for themselves and their families. So our policy solution is to create federal legislation for an expansive right to access abortion. It would include legislation like the Equal Access to Abortion Coverage and Health Insurance Act, also known as EACH. This legislation would eliminate the Hyde Amendment and other onerous restrictions on federal abortion coverage, and would make the federal government the standard bearer of care. So for those, HIDE has banned abortion care in federally funded programs. It restricts, its restrictions affect Indigenous people who get their care through Indian Health Services, individuals in federal prisons and detention centers, including those detained for immigration purposes, and also beneficiaries of Medicaid, Medicare, and CHIP. More than half of women of reproductive age who are enrolled in Medicaid are women of color, and 55% of these women live in states that restrict insurance coverage for abortion, except in limited circumstances. Research suggests that bans on Medicaid coverage for abortion results in 1 in 4 low-income women carrying an unwanted pregnancy to term. Black women, girls, and gender-expansive people are more likely to live in states with these restrictions, the same states that make it harder to access contraception and that offer the fewest resources to help Black families care for their children. We also must consider the issue of self-determination, which is particularly relevant with respect to contraception and family planning. Contraception has had enormous benefits for women's health as well worldwide. Contraception has numerous benefits, including the individual's ability to improve personal health, economic stability, and educational outcomes as well. So our policy recommendation would be to pass the Affordability and Access Act, which improves comprehensive access to cost-free family planning drugs and devices for all individuals in the United States, especially the millions who live in contraceptive deserts. It would make oral contraception over the counter without a prescription. Another would be to codify Title X family planning regulations, which would ensure that the federal government provides a clear mandate that all people, regardless of their insurance coverage, employment, or immigration status, can access comprehensive family planning, counseling, and services. And of course, when we talk about abortion, we also have to think about the impact that this has on, if one is forced to carry a pregnancy to term, this also impacts maternal mortality and morbidity. So by passing the Momnibus, which is a series of bills that address poor maternal health outcomes, it would be a significant step forward in mending the maternal health crisis here in the United States. These are just a few policy solutions to ensure access to comprehensive reproductive health care. There are certainly many more listed in our agenda.
Thank you, Bridgette. And I just want to note how many of those policies serve to expand everyone's access to quality and affordable care. And it highlights just how expansive reproductive justice can be as opposed to Project 2025, and why it's what we need as we face a crisis in reproductive healthcare access and a Black maternal healthcare crisis. Next slide. Edwith, shifting back to our conversation about the economy, can you tell us about what effective policy solutions can be implemented to counteract Project 2025 and ensure the protection of the economy?
Sure. Well, as I shared earlier, a bunch of different policies that are included in Project 2025, and a lot of those policies are going to be barriers to reproductive justice. It prevents access to resources, increases healthcare costs. It really digs into work and family economic balances, and there's so many other different kinds of elements. So the policy solutions that would help boost the economy, support working families, support economic mobility are very simple, straightforward policies. We need to cut taxes for working people instead of increasing them. We need to lower food and grocery costs. We need to lower healthcare costs, lower prescription drug costs, lower energy costs. We need to do all of these things to ensure that people are able to take care of their families and to be able to do so and afford and get the things that they need. We also need to provide opportunities for economic mobility and growth, such as helping people buy homes and making rent more affordable. We also need to invest in small businesses. Access to capital is a huge struggle and barrier for a lot of minority-owned businesses. So this is one way, one policy that can really help make a difference. Another one is that we need to invest in American innovation and industrial growth. And a lot of that is also tied to investing in HBCUs and ensuring that they are able to be beacons of innovation as well. We also need to create security and opportunity for workers and build a care economy. I talked a little bit about some of the policies that are included in Project 2025, which really which really weaken our care economy, such as the tax to Medicare, Medicaid, and all other elements. And also, we need to strengthen opportunity within our communities. So in any way that we can invest more in education, in training, and all these different elements that can help really create economic mobility. So a lot of the policies that are solutions to the barriers that Project 2025 is trying to construct in our lives are very straightforward. You know, people need more money in their pockets and more opportunities. And that is definitely items that are part of the reproductive justice framework.
Thank you, Edwith. We know all of those policies are top of mind to our communities and that the solutions are there. And in this moment, we need critical investments in our communities to create economic mobility, not cuts to programs that are essential to Black women, girls, and gender expansive people. Next slide. And Bridgette, can you tell us about what effective policy solutions can be implemented to counteract Project 2025 and ensure the protection of our workforce?
Well, paid family leave, affordable childcare, and workplace protections are essential components of a comprehensive approach to reproductive justice policy issues. It's recommended to establish a permanent, accessible national paid family and medical leave. The United States is the only nation among high resource countries without a national paid leave program that leave Black women, girls, and gender expansive individuals at the mercy of a wildly varying federal, state, and local policies. It's recommended that Congress should establish a permanent paid leave program to cover the usual considerations of family and medical leave, such as childbirth, illness of an employee or a family member, as well as other reasons for leave, like a national disaster. Reproductive health care, including access to abortion, is key to ensuring women's autonomy and decision-making about their careers, education, and personal lives. And it is recommended that Congress reform eligibility for Medicare and Social Security programs that would implement eligibility requirements to better control and account for income fluctuations and race, gender disparities in wages over the course of a lifetime. This would more effectively address also economic disparities that current policies affecting CMS limit eligibility and economic well-being assessments and isolation of annual incomes. So as a result of all this injustice embedded in our systemic and institutional racism and gender discrimination, Black women, girls, and gender expansive individuals are more likely to lack economic resources compared to Americans of other races and ethnicities. And I do just want to kind of close out, just kind of touching on what Edwith is talking about. But Black and brown workers have far less wealth than their white counterparts. And many women and people of color are also members of the working class. Thus, reproductive justice has to be considered when we are discussing like equitable workforce policies to ensure that they are as expansive and as inclusive as possible.
Thank you both. We know that reproductive justice policy solutions are going to be what gets our communities to the places that we all want them to be. And so next slide. I actually want to open us up for our Q&A portion of the conversation. I know we've gone through a lot of critical information tonight. So if you have any questions, please put them in the Q&A box, and we're going to try to get to as many of them as possible. give us a moment while we go through questions.
Hi, all. I'm going to be reading some of the questions we're getting as they come in. We'll try to get through as many as possible. The first question is for either Bridgette or Edwith. There's been a long history of forced sterilization of Black and brown girls in the USA, particularly in the South. How do we include our young girls in this discussion? Because they need to be able to articulate issues if there are problems with their bodies.
Certainly. To the history of the forced sterilization of Black and brown girls in the United States, we can look to the Dobbs decision and where that came from, which is Mississippi, which was also known as the Mississippi myendectomy, right? Because the forced sterilization of Black people from, I believe it was the 1940s throughout to like the 1980s, where they had significantly high rates of forced sterilization of Black people as well as poor people within the state of Mississippi. When we look to Project 2025 specifically, we've already discussed the elimination of references to abortion, reproductive health care, and sexual and reproductive rights. What we did not cover was the elimination of comprehensive sex education. So one of the topics or one of the policies proposed in Project 2025 would be to skirt comprehensive sex education and also, for lack of a better word, highlight or strengthen the idea of this pro-life movement to deny critical education, not just on sex education, but also on reproductive health more broadly.
I'll add just like a couple 2 cents to this as well. I think something to think about as we think about Project 2025 is that regardless of the outcome of the election, these policies are still in motion to be implemented, and in some places have already been implemented in different ways. And the reason why I bring that up is because you're right, there is a long history of forced sterilization of Black and brown girls in this country and in the South, as mentioned. And that is something that we need to be concerned about because it had already happened. And as Bridgette connected some of this to comprehensive sexual education, sex ed, there are some states who are already either getting rid of comprehensive sex education or do not have it at all. So I just wanted to draw that connection that regardless of the outcome of the election, regardless of what happens moving forward, some of the policies within Project 2025 are either policies that people are working diligently to implement, are already implementing. So just wanted to make that connection.
Thanks, Edwith. The next question we have is, how can someone get involved in the reproductive justice movement?
There are so many different ways to get involved with in the reproductive justice movement. I think being an advocate and really looking at and being truly just being there for your community is a great way to be a reproductive justice advocate. As we look to the policies that we want to reinforce, that is being a reproductive justice advocate. And it's a more holistic approach as well. So there's no right or wrong way to go about doing that. And I would also just say, take a look at both In Our Own Voice, National Black Women Reproductive Justice website, as well as our C4 as well, to get some ideas of what we're currently doing. This is a very interesting time for us within the reproductive justice movement. We see what's going on in various states across the country regarding access to abortion care and maternal health care more broadly. And so it's just it's a critical time to become a member of the movement. We welcome you to it. I'm sure you probably already are.
And I'll just say, if you're thinking about doing it, I highly recommend that you do it. Reproductive justice is involved in so many different things and connected to so many broader issues. I started my career doing reproductive justice work, so highly recommend folks get into it.
Thanks both. The next question is, someone is curious about specifically the impact of Project 2025 on the elderly.
I talked a little bit about some of the impact of it in my presentation, where I discussed changing the age of retirement, also changing some of access to certain different kinds of benefits, and also how Project 2025 itself would weaken the care economy. So for those who might be in need of long-term care, who might be in need of particular kinds of healthcare, Project 2025 basically makes it very difficult to access those things. So just like most of Project 2025, it will not have a positive impact on the elderly. And I'll just add this as well. If you want to not read the 900-page report of Project 2025, there are a lot of great resources that dive deeper into it. I know at the Center for American Progress, we have state-by-state fact sheets, and I'm sure Bridgette will also talk about some of the resources that In Our Own Voice is working on. But the highlight of the impact of Project 2025 on the elderly is that it is not good.
I would echo Edwith's sentiments. We do have, I would again go to the RJ agenda to take a look at that. We also do have some state-specific fact sheets. And so to just get a broader understanding of reproductive justice more generally, but for the elderly specific information, check our agenda.
Bridgette, this actually leads perfectly into one of the questions we've gotten. It says, we've talked about Project 2025 at a national level. How is this going to impact state-specific policy?
Well, if Project 2025 is implemented, then it will be left to the states, right? So a lot of what you see here will be based on administrative agencies and federal agencies and the like. So a lot of what we will be looking at is huge inconsistencies across this country. And some of the more southern states, the policies implemented will likely, I mean, it's going to be at a larger level. So it'll be different from the state level laws that we'll be seeing. So a lot of the policies from Project 2025 will impact administrative agencies, and then that will trickle down into the work that we're seeing at the state level, if that makes sense.
Yeah, like I said, Project 2025 aims to change the way government works, and it moves us closer to an authoritarian state. It localizes a lot of power within the presidency and its agencies, and then it also kicks a lot of power back to the states. So definitely will create a patchwork of access to resources and also a patchwork of access to rights. And we saw that happen with abortion. Before Roe was essentially gutted and done away with, we saw tons of attacks and restrictions happening throughout different states. So we're going to see that pattern being duplicated among many rights and also in accessing different kinds of resources. And like I said earlier, Project 2025, a lot of the policies that are in there are basically policies that conservatives and the folks who want this stuff to be put in place, they're working very hard to already establish a lot of those policies. So we're going to be seeing that patchwork already start to appear.
Thanks both. We are getting a ton of questions come in, which is great, but I think we only have time for 2 or 3 more. So if folks could just get their questions in the last few minutes. I am trying to go through as many of them as possible, but thank you so much for being engaged and asking questions. I am going to go with this one. This person asks, Bridgette or Edwith, could you speak more to how Project 2025 is impacting birth control, will impact birth control specifically?
I'm happy to kick it off. So within Project 2025, through HHS and other agencies, they do plan to eliminate access to, they will continue to restrict access to federally funded resources for reproductive healthcare services, including contraception. So it's the policies itself vary greatly. However, for contraception, we know that it's used for multiple things, right? So it's not just used to prevent pregnancy. It's also used for people with endometriosis and uterine fibroids. So the lack of access that we're going to see for the uses of contraception will be far reaching, but the policies themselves will be really dependent on the agencies like HHS and CMS.
Great, thank you, Bridgette. Next question, and then I will look through and do one more. How do you all propose to pass some of the policy solutions that you've mentioned during this panel?
You want to take that, Bridgette?
Back to me. So the policies that we've mentioned are, some of them are novel, but most not so much, right? Like a lot of this is going to be left to the federal and state governments to enact a lot of this legislation. It's not just going to be the presidency that matters, but also the election more broadly. We have to look to the federal, state, and local electeds for a lot of these policies. We also have to look to the Supreme Court and other courts as well, because that also has an impact on our access to care. And so we know, for instance, with the Dobbs decision and the overturning of Roe, it turned to the states and it turned to the state legislatures to determine whether or not access would be available. So similarly, it's broad strokes. There's no right way or specific way that a lot of these policies could and will be implemented.
I totally agree with what Bridgette shared. I will say this, though, I think we've talked about a lot of different kinds of policy solutions that could be implemented at the federal level, at the state level, and policies implemented in different other particular areas. And I think that in terms of policy making and to see the things that we want to see, it is going to take a lot, not only at different levels, but also through very different mechanisms. There's going to be a need of narrative shift and making sure that people understand what are the policies that we don't want and what are the policies that we do want, or the policies that are good for us. We also are going to need to do a lot of work to ensure that the people who are in office can show leadership on these issues, because it's not enough to vote them to be in office, but we need to ensure that they're able to drive those policies, right? And be able to defend those policies that we want to see. So I can go on and on about policy making, about how government works and all of those different things. But I think the most broad and thing that I'm going to say is that regardless of how the government is structured, to be able to see policies that really help and support our families and help our community and keep us safe is going to take a lot of work.
Thanks, Edwith. The last question we have for tonight is, could you speak more to how Project 2025 is going to affect Black and Brown veterans and disabled folks?
I don't have a lot of information on that, but I will say that, I mean, at the core of it, Project 2025 wants to take away resources. It also wants to take away a lot of different equity measures that have been established under this new administration and that we've had longstanding with So I think that is going to be a major concern in terms of how it will impact people. They definitely want to get rid of benefits, access to resources. So those who are either most vulnerable or who are dependent on a lot of these services and programs will definitely be made vulnerable under Project 2025.
And we do know that there were a few regulations that were passed under the Biden administration that expanded access to abortion coverage for veterans and their beneficiaries. I can't go into great detail on that, but likely the policy agenda, like just based on the elimination of a lot of these other rights, they're likely going to try to get rid of some of those regulations as well.
Thanks, Bridgette and Edwith, and thanks everyone for contributing questions. This was great.
Next slide. Someone asked how they can get involved in the reproductive justice movement, and this would not be a reproductive justice webinar if we did not have options for you all to get involved. So the fight to protect Black women, girls, and gender expansive individuals requires collective action. We cannot afford to sit on the sidelines. So these are a few ways you can get involved. Support candidates who support us. Stay informed, read the Reproductive Justice Policy Agenda at blackrj.org/BlackRJ Policy Agenda. Keep up with In Our Own Voice Action Fund, and you can also register now for session 3, which will be Beyond the Bullet, Gun Violence and Black Reproductive Justice. And also spread the word about the work we're doing with people in your community. We know that there is a lot of change that can happen just by all of us talking to one another. I also just want to open it back up to the panelists to also plug a few other resources.
Thank you so much. And I also want to say thank you to everyone for putting this together. Greatly appreciate to be part of the discussion. But in terms of resources, so the Center for American Progress and the Center for American Progress Action Fund have developed a lot of different resources on Project 2025. We could not fit all of the different policy proposals that they are trying to implement and driving for into this conversation. But if you are interested in learning more, we do have a bunch of resources on our website to check out. So really encourage you to learn more about Project 2025 and also continue the conversations on Project 2025 and make sure that everyone knows about it.
Thank you so much for joining us tonight, and a huge thank you to our panelists, Bridgette and Edwith. To learn more about either In Our Own Voice or CAP and CAP Action Fund, please stay connected with us. Our socials are here, websites are here, and ways to contact each of us. Any final thoughts from our panelists before I close this out? No? Okay. Thank you for joining us tonight. As you heard, Project 2025 would be devastating to our communities, but there is another option. Policies that center reproductive justice are what we need in this moment, and we look forward to working with all of you to build a reproductive justice future. With that, have a great night.